Hello, everyone. It's just about 2 o'clock, so we're going to get started shortly. I just want to introduce myself. I'm Sherry Kelly. I'm an epidemiologist with Born Ontario out of the Ottawa office. And today we're here to talk to you about the enhancements that we've made to the Maternal Newborn Dashboard Report. So hopefully everyone is able to join us on the webinar as I'm about to present a few slides. And just to take care of a few housekeeping items. If you have a question, you're very welcome to type it into the chat box that's on the top left-hand side of your screen. We're also going to be opening the floor at the end of the presentation to questions if you prefer to hold them till the end. Also, depending on the size of the slides that are appearing on your screen, you are able to increase or decrease, if needed, the size of your view just by going at the top. There's a drop-down box. It should say auto right now, but if you drop down the box, you can choose 100%, 200%, etc., or view full screen, just to make it a bit easier for you to view the details of the slides. So like I said, again, we're going to go over the enhancements that Born Ontario has made to the Maternal Newborn Dashboard Report. So today we're just going to show you a brief, not necessarily an overview, but really where to access the training materials on, if you've never seen the Born Information System. So an introduction to the Born Information System, as well as an introduction to the actual tool, the Maternal Newborn Dashboard, if the hospital users on the line have yet to see the tool. Now, the tool, of course, was rolled out in November of 2012, so just at the end of last year, and it's available to hospital users throughout the 106 hospitals in Ontario that are contributing maternal and newborn data to the Born Information System. And the meat of the actual presentation is to show you the enhancements to the Maternal Newborn Dashboard report. And they actually pertain to the Subreport, but we'll get into the details in a minute. And of course, we're leaving quite a bit of time at the end if you have any questions about these enhancements, as well as any questions about the actual dashboard. So like I said, if this is your first time being introduced to the Born Information System, it's the database and information system that's available to all hospitals, midwifery practice groups, as well as other users involved in maternal and child health across the province of Ontario. And in order to access more training materials about getting started in the system, you can go to the link that I've put at the top of this slide. And once you go to the link, you just need to navigate down to the PowerPoint presentations, and you can look at PowerPoint presentations on getting started, logging into the system, what the landing page should look like. And as the Born Information System is organized by different encounters across the continuum of care, there are presentations for each of the encounters in the continuum. So anytime you want, you can go and access these slides. And you can familiarize yourself with the Born Information System. Just to mention one more thing, since the Born Information System has various reports available to users, we've created what we call a roadmap of these reports in the document, again, that's listed below, in the link below. And just to mention, these slides we're going to be posting up on the Born Ontario website, and I'll show you where in the next slide. So moving on, there are various training materials for the Maternal Newborn Dashboard. So this is where we'll be posting these slides at the end of this talk at bornontario.ca/report/dashboard. And this has all the pertinent information about the Maternal Newborn Dashboard, things like the briefing note, which I have an arrow pointing to where they're available on the page, the knowledge to action evidence summaries for each of the 6 key performance indicators. If you haven't already accessed those evidence summaries, they're available on the Born Ontario website down in the middle here. And lastly, the training slides and the webinar, which is the video recording of the webinar that we gave in mid-November, right before the rollout or the release of the Maternal Newborn Dashboard. So the trainings were done around November 16th, and they're posted at the very bottom of this website. You can either access the slides, so those are the PowerPoint presentations in PDF format, actual webinar video, and you can follow along and just go through the video just as we did as a live demonstration in November. So if you haven't already seen or heard of or used the maternal newborn dashboard, you can access these materials to familiarize yourself with the dashboard. I'm going to show you a little bit about where to actually access the dashboard in the Born Information System, but if you need any background information, please access those materials first. And I wanted to just show you what an evidence summary looks like. So this is for the elective repeat C-section key performance indicator, or key performance indicator 4, and it basically gives you a summary in one page, the evidence summary about, summarizing this particular indicator and all the key messages surrounding it. And this was put together by Born Ontario together with the OHRI Knowledge to Action Evidence Group. Next, I wanted to show you when you first log into the Born Information System, you'll see a welcome message, and then you have the various blue navigation menus. The first thing you'll have is the actual announcements messages. So if we post anything new, like new reports, or for instance, when these actual dashboard report enhancements went out, we posted an actual announcement that you can read a little bit about. And underneath there will be your patient records. So that's all the patient records that you may have entered or your group has entered into the Born Information System. And then below that is a snapshot of the maternal newborn dashboard landing page. So the landing page gives you a quick view of the dashboard. So there are three things. There's a list of the key performance indicators, 1 through 6. There's the rate for that time period, as well as the status colors. And I'm just going to show you a bigger view of what the landing page looks like here. And again, this is as if I accessed the Born Information System today. This is what my landing page would look like. And as always, the dashboard, landing, and home page rates are calculated based on 3 previous months of data. So we're in the month of February. We're allowing the month of January as a lag month. And that's so that users in hospitals or the hospital group altogether can acknowledge the data for that month of January to allow them time to catch up with the acknowledgement process. And what the acknowledgement process is being able to reconcile and validate your data. You're going through a data quality management process, running several reports which allow you to validate your data. And once you actually validate your data, reconcile it, the number of births, all the incomplete encounters, any missing data, you can actually check that you acknowledge the labor and birth data for a given month. So when you've done that for the months of October, November, and December, allowing January as a lag month, then the month of February, for the entire month of February, these would be your rates in the dashboard. And again, this is just test data or mock-up data, but when you log into the Viz for your hospital site, you would see your live data on the landing page. You may have to scroll down under your patient records, but that's where you would access the landing page, which is just a screenshot to give you the rate and the status. And again, the status are marked as red, yellow, and green. Red meaning alert, yellow meaning warning, and green meaning the target, and those are the benchmarks that have been set for each key performance indicator. And if you want to learn more about how the benchmarks were set and what the rates are, you can look into the evidence summaries, and I'm going to show you a little bit more on the home page what the actual benchmarks are set to. So like anything, there's always footnotes underneath the landing page, things like the data source, as well as notes that pertain to the landing page itself. And it tells you about how rates and statuses are based on 3 prior months of data. If you see a gray status, that indicates that you have not acknowledged your data for the 3 months, and no data indicates that maybe there are no records that meet the criteria. So next, I want to show you how to access the maternal newborn dashboard, or just we'll call it the dashboard homepage. So the first thing is on your actual landing page, you go to the reporting menu at the top. You click on that reporting word in blue, and that leads you to the reporting tab. The first tab is the dashboard tab. So if if you're already logged in to the Born Information System and you just navigate to reporting, you should see right below this the actual home page for your site, which will appear like this. So the home page has everything the landing page has on it, the list of the key performance indicators, the rates, and the statuses, but in addition, it has the benchmark rates, like I said, the target, the warning, and the alert, the green, yellow, and the red values for each of the key performance indicators. And lastly, over on the right, it has the actual comparator rates, so the other similar level hospitals, the other similar birth volume hospitals, as well as the provincial rate for that time period. So those are the home page and previously the landing page of the dashboard. Hopefully you've seen this already. And the next thing is if you want to actually dig deeper into the data, you want to run the dashboard report. So from the home page, you don't have to go anywhere anymore because we added this link to run the report directly from this. You can click on this text in blue here, Maternal Newborn Dashboard Report, which is pointed to by the arrow, and you can just launch the report. If you happen to already be in the Clinical Reports tab, which is the second tab here, you can navigate there and scroll down to the Maternal Newborn Dashboard Report and launch it from the Clinical Reports tab. It's really at your preference. So this is what the dashboard report looks like. It's very detailed. It gives you the data by month, quarters, and fiscal year to date, as well as the totals. And it gives you the data for your hospital, as well as data for the comparator groups, the 3 comparator groups that I mentioned previously. And I don't want to get into too much detail about this report, as we've covered this in previous web training webinars, but what I want to point you to is the enhancements that we've made to the Subreport. So this report is for Key Performance Indicator 4, which is on the elective repeat C-section prior to 39 weeks. So as an example, if I'm interested in the data for December, and just to note that for this report, I ran it from April 1st to December 31st, 2012. So unlike from the landing page and the home page, which are set to the 3 prior months of data, allowing a 1-month lag, in the report you can actually select whichever reporting period you prefer. So I selected April 1st to December 31st, and this is the outcome for the Key Performance Indicator 4. And this is if you were actually live in the biz and you ran the report and you're interested most in the cases that for the elective repeat C-sections that happened before 39 weeks in the month of December. And I know this is very small, but for the month of December, the value is 5. And so if we were to click on this 5, which is blue and underlined, it has a hyperlink, just like you would see on a website. You click on that, and that runs the Subreport, which I'm going to show you next. So you can click on any of these values for your hospital data for either the month or the quarter or the fiscal year to date or the total period that you selected, and you can just get this Subreport for any period of time. I'm going to show you, and once again, this is test data or mock-up data. I'm going to show you the records for December. When I click on this 5, where the circle is indicating, it launches the Subreport, which looks like this. It's quite small, so I'm going to break it down into 2 separate slides. But basically, I want to show you that, there were 5 maternal records in the month of December for which their elective repeat C-sections were performed prior to 39 weeks. So you'll see a list of 5 records. And on the left-hand side, you can see that there's another hyperlink or a chart number. So these are the chart numbers that lead you to the patient profile summary. So I'm going to show you this a bit bigger in the next slide. So you can see here on the left, the first record is chart number 11111. This is just a mock-up example. And if you were to click on the actual number, it launches you in the Born Information System to the patient profile summary, so you can obtain any information on that maternal record. But in addition to actually now linking to the patient profile summary on the left and just having the list of IDs, which is what you had before, we've added everything here on the right, all these columns. And these columns pertain to data elements that were used to select these records based on the criteria for this indicator. For instance, the first column is the pregnancy outcome. So for all these women who had an elective repeat C-section prior to 39 weeks, we know they were low-risk women. so the pregnancy outcome had to be a live birth. And that's what you'll see in this first column. For all of these records that would be available in the subreport for this indicator. The next thing we know that these women gave birth, or had an elective repeat C-section from term to less than 39 weeks. So the gestational age at birth would be between 37 and 0 and 38 and 6 days. We know also that these are singleton or single fetus pregnancies, and so the number of fetuses always has to be 1. The next thing, since this indicator is elective repeat C-section, we know that the number of previous C-section has to be 1 or more. So it can be 1, 2, 3, or so on for a particular maternal record. The type of birth always has to be no labor C-section, in that the women didn't labor, but that she had the elective C-section. So that's the type of birth. And lastly, and this is the most important, these are all indications for C-section. So these are the possibilities that this indicator would pick up, and this is why these women are identified as being captured by this indicator. So for instance, if the mother had a previous C-section, of course she would fall into this indicator, but that's not enough reason to have the C-section performed prior to 39 weeks. This indicator is really all about timing. It's not about the fact that there was an elective repeat C-section. It was that the elective repeat C-section was carried out prior to 39 weeks gestation. So if there was only a previous C-section and that's the only other indication, this record is being picked up as something to look at by your team. The next, an example of an option is fetal malposition. So if there is fetal malposition, again, this is not enough clinical reason for the C-section to be carried out prior to 39 weeks. Another example is if it accommodates the care provider. Again, this could be an indication, but it shouldn't be the only reason why the C-section is performed prior to 39 weeks. The same as maternal request, the option in the last row or the last maternal record example. So it's not to say that you shouldn't be able to accommodate a maternal request, but it shouldn't just be that a mom asks for an elective repeat C-section and that you actually schedule her before 39 weeks. So that's really the issue here, is that while the mom may have asked for the C-section, I think it should be the responsibility of the hospital organization when you schedule that C-section. So these are just 5 examples of maternal records that would have been picked up in this indicator. Now there's a bit more to this table, so I'm going to show it to you in the next slide. And this is to say, because these women in this indicator are only low risk, those are the only women that we included in this indicator, that any condition or complication option or selection has to be none. So there can be no conditions and no complications. So you shouldn't have any pre-existing maternal health conditions for the women that are picked up or captured by this indicator. There shouldn't be any complications of pregnancy. There shouldn't be any diabetes in pregnancy. As an example, if there was gestational diabetes, this woman would be screened out of this indicator. If for hypertensive disorders, any women with hypertension would be screened out of this indicator because they're not considered low risk at that point. As well as labor and birth complications, it all has to be none. So for all these conditions and complications that you'll see in the subreport, and that's how the indicator was set up, all these conditions and complications must be none. So again, as always, underneath the subreport, there are footnotes that lead you to the data source from Born Ontario, the definition of this indicator, and for this subreport, the definition is the summary of maternal records for low-risk women with a C-section performed from greater than or equal to 37 weeks, which is term, to less than 39 weeks gestation. And we even have in brackets the number of weeks and the number of days in a given place or time. And it goes on to say the note, repeat C-section in low-risk women is defined as a cesarean section performed prior to the onset of labor among women with a singleton live birth. And again, we saw that from the previous slide that, the number of fetuses is 1. With a history of 1 or more previous C-sections, again, we saw that from the previous slide. I'm actually just going to move up quickly. With a previous C-section, so we know from the number of previous C-sections is 1 or more. And with no fetal or maternal health conditions or obstetrical complications. complications. And that then is the second half of this table where, again, there are no conditions or complications. And the last part is that with women with indications for cesarean section are excluded, so any indication, they're excluded, other than women with the following indications: fetal malposition, malpresentation, which I've shown you in the example above, previous cesarean section, accommodates care provider, organization, or maternal request. So for any of those indications for C-sections, if those are the sole indicative reasons, then these records are going to be captured for this indicator. So just moving on, that is the subreport enhancements. And just to let you know that that was for Key Performance Indicator 4, but of course there are 5 other indicators. And we've already implemented the enhancements for Key Performance Indicator 4 for the elective repeat C-section, but we're going to be implementing it for the other indicators in this report so that you can also have these similar enhancements to the subreport. So this is just to show you a mock-up for the other Key Performance Indicators. So for Key Performance Indicator 1, the newborn screening samples that were unsatisfactory for testing by reasons for unsatisfactory samples. So this is just to give you a summary of all those records that had unsatisfactory sample testing and some of the reasons. It's basically to give you a list. This is just an example. It shows 2 records, but in a month you may have, 2 or more, and in a quarter or in a fiscal year you may have a long list of records, and it will give you the entire list. So you can see some of the commonalities showing up again and again, maybe some of the reasons that the samples were unsatisfactory. And just to give you a bit of additional information, it actually tells you what the gestational age at birth was for that infant record. But you can always click on this hyperlink on the left-hand side. The ID here is 111110, and that would lead you directly to the patient profile, which in this case is the infant record. For KPI-2, episiotomy in women who had spontaneous vaginal birth, it's the same kind of thing. You would see what the pregnancy outcome was, what the type of birth was. In this case, it has to be spontaneous vaginal birth, and what the episiotomy type is, midline, medial, lateral, etc. Gives you a bit of additional indicator information to tell you what the parity was for that woman. So this is the subreport that will be coming soon for KPI-2, episiotomy in women with a spontaneous vaginal birth. The third indicator, and I don't know if you want me to go through all these, is for formula supplementation at discharge in term infants whose mother is intended to breastfeed. But basically, again, you can see the gestational age, the intention to breastfeed, and it always has to be yes, of course. That's how we set the criteria for this indicator. The newborn feeding at discharge would be either formula only or combination. In that combination is breast milk or formula. So it contains one element of formula feeding. And that's why this record is being captured for this indicator in the subreport. And just an additional indicator information, we give you the reason for breast milk substitution. So for instance, if the infant was hypoglycemic, that might be the reason that this infant was fed formula. If the mother has medical, for instance, this says severe maternal illness, perhaps she wasn't able to breastfeed, and that's why you see the combination for the newborn feeding at discharge type. So those are the key performance indicators 1, 2, and 3, and they will be coming soon. We'll let you know once they're available in the dashboard report. And again, key performance indicator 4, the elective repeat C-section, which I've already gone over, has been released for the last week or so. And so you can go now in the BIS, the Board Information System, run the report, click on Key Performance Indicator 4 tab, and you can directly launch the subreport with the enhancements. So the last 2 indicators are also coming soon. So for Group B streptococcus or GBS screening at 35 to 37 weeks, which is KPI 5, you can see that this will be the subreport enhancement once it's available. So you can get the gestational age at birth and the fact that the GBS screening results were not done. And you can get the list of records as well as the link to the patient profile. So the last one, key performance indicator 6, is women who were induced with any indication of post-dates who were actually less than 41 weeks gestation. So you can see that they were induced. Here is the indication, but the actual gestational age is less than 41 weeks. So even if they said post-dates, it is less So those are coming soon. So just to summarize, these enhancements to the dashboard subreport will definitely save you time. You no longer have to run the maternal patient experience report like we've instructed you to in the past and filter the data yourself. It's all available in the subreport directly, at least for KPI 4, which is seemingly gets the most attention and what users are most interested in, so that's why we implemented it there first. And we're working hard to have it implemented quickly for the other indicators. So of course, this allows faster identification of any inconsistencies or commonalities, and this is part of your audit and feedback process. And it gives you a direct link to patient profiles, which should just provide you as much information directly as you wish when you're drilling deeper and deeper into this dashboard and dashboard reports. So I just want to reiterate that the dashboard report, they're tools, and of course a tool is only as good as you're able to use it and implement it in your system. So this slide was put together by Sandy Dunn, who is the knowledge translation specialist with board. And basically she said, part of this plan, do, study, act cycle. Once you get the dashboard results, really it's now a matter of taking it back to your team and meeting together to basically decide what you're going to do about it. So, for instance, you need to decide, who's responsible if there's a red signal, who's responsible to respond to that alert signal, and just some kind of accountability. So who's going to continuously be following the results of the dashboard? So, and it's in a follow-up or iterative process. So just identifying key personnel. For instance, you might identify a dashboard representative or a dashboard go-to person at your organization, and just identify that person or those persons and define what their roles will be, and communicate it with the group. If they don't communicate back to, for instance, the newborn screening lab, that might be in, for instance, a NICU unit, or communicate, the results to the healthcare practitioners that are actually following these practices, then of course, the results fall flat. So it's important to really communicate together with the team. So the next step is to do. So of course, all along, you're verifying and validating your data through the data quality management process, but also acknowledging your data such that you can even see the results on the dashboard landing and homepage. But as part of validating your data now, you can go to the subreport and you can actually check that every piece of data for that mother that was captured for this indicator was correctly entered, because you have access back to the patient profile and you can match it to your chart. And you can plan action based on validated signals. So, for instance, you say, okay, we really do have 5 women for the month of December that had the elective repeat C-sections that were done too early. What are we going to do about it? How are we going to either improve scheduling or educate or, just have a plan of action? So the next thing to do is study. So the signal indicates a potential issue, but it doesn't tell you why. So there are reasons, for instance, that we list for unsatisfactory samples, but we don't know why the actual samples were collected in that fashion. So especially if there are repeated sort of instances, like common problems, perhaps you can go back to your team and evaluate the processes, the practices that are in place in your organization. And this is really now, the next thing is to do a clinical audit. So identify practice issues and processes that may be contributing to rates that are high or in some really low that might be problematic. So really now it's a responsibility of you and your team to go back and identify any problematic practices or processes in your hospital. And we realize, this is a big process. It's not something that happens overnight. It takes a team of people. And we know that your first and foremost responsibility, of course, is to the patients and to their families. But we want to make this tool available to help guide you in your work. So, use it as you're able to. Let us know if there's anything you feel that we can help improve in either the report, in the board information system, just to make your lives easier. And the last step, of course, is to act. So to develop appropriate tailored strategies for change, to implement plans, and for sustainable practice change. So you can institute a policy change, but you need to continuously monitor and evaluate the results. Otherwise, it's human nature just to slip back into old practices. So this has to be all I wanted to show you. And of course, if you haven't already met with the team at your hospital, if there are certain indicator alerts that are problematic that you want to address, you can use this slide as a guidance point, or you can go back to your board coordinator and ask them for guidance or assistance in making this process more formalized. You can also contact myself or Sandy. I have our contact information on the last slide, and we can help guide your team in this process. So like I said, the last thing for support for the Born Information System or the Maternal Newborn Dashboard or any report or anything to do with this entire process, you can first contact your Born Regional Coordinator. So hopefully you know who your Born Regional Coordinator is. If not, again, I have my email down at the bottom of the slide, as well as Sandy Dunn, the Knowledge Translation Specialist, who has been involved throughout the entire process of the dashboard being, just coming with the idea of having this dashboard, selecting the indicators, selecting the benchmarks, and so on and so forth, and having the clinical background and meeting together with a group that's helped to establish this dashboard. So today I was just here to show you what the enhancements are to the dashboard subreport and hopefully address any of your questions. So I'm taking a look now at the chat message box, and I don't see any questions in the box. So first of all, I wanted to just thank you for joining the call and thank you for your attention. But I'm just going to turn it over to Val Emerson, who's the administrative assistant at Born, and she's going to help me manage any questions in the call queue. So Val, if you wanted to either let me know if there are any questions in the queue or to instruct the users on how to use the queue, that would be great.
Sure, Sherry. So in order for you to place your question in the telephone queue, what you need to do is press 01 on your telephone keypad, and this will place your question in the queue. As your questions come in, I will unmute you individually one at a time so that your question will be able to be asked. And if you notice that your question has already been asked or you would like to remove your question, please press 02 on your keypad.
Thanks, Val. So just until we wait for a question, and even if there isn't a question, that's fine. I think this enhancement to the dashboard report is fairly straightforward. Like I said, it's available for Key Performance Indicator 4 on elective repeat C-section. It will soon be available for all the other indicators, but perhaps now is really the time that you or your team is able to go back into the Born Information System, run the dashboard report, and actually check out the sub-report and see the added information and hopefully benefit from the enhancements, to either go to the patient profile or to see directly in front of you the summary of data for that, meeting the indicator criteria. So do we have any questions so far, Val? It's possible we don't.
No, Sherry, there's no questions in the queue at the moment.
Okay, that's fine. And again, we set this webinar for an hour. We figured it might take around half an hour, but we wanted to allow for any questions at the end. So if you don't have any questions now, then that's fine. That's great. We'll make these slides available on the Born Ontario website, just at bornontario/report/dashboard, as I showed up on the first 2 or 3 slides. And if you find that once you actually get a chance to go back to the report and see the sub-report enhancements and you have any questions thereafter, you're welcome to contact your regional coordinator or myself or Sandy, and we can address your questions on a one-on-one basis. So I guess then we'll close this session, and we'll thank you for your attention, and thank you also for all your efforts in, first of all, collecting data, putting it into the Born Information System, running the reports, and also, of course, paying close attention to the dashboard as it pertains to your organization. Thank you very much. Bye now.